Just by way of introduction, I'm Dennis Wright, Chief Scientific Officer, and I have been with CLINUVEL for over 19 years. Okay, so CLINUVEL has established itself as a global expert in melanocortins. These are peptides which exert their effects throughout the body by binding to different melanocortin receptors. We focus on, at the moment, two of these, afamelanotide and ACTH. Afamelanotide is an analogue of the naturally occurring alpha melanocyte stimulating hormone, and it has been shown to play a role in a number of areas. It stimulates the melanocortin 1 receptor in the skin, and that enhances the pigment melanin in the skin, and I think you've seen it referred to as a bronzing or a tanning effect. The enhancement of melanin provides protection against inbound visible and ultraviolet light, and afamelanotide also assists in the repair of DNA that's been damaged by that ultraviolet and visible light. It also has other properties, anti-oncotic and strong antioxidative effects. And the company, as you know, has commercialized afamelanotide as a control-release 16 milligram implant for the use in EPP patients. We are now undertaking a program in vitiligo, so we are adding an additional indication to our range of activities for CNS, and that program is ongoing. And I think after the break, I'll have to say a few words on vitiligo. In addition to the implant, we've also got second generation products. I think you've seen media releases on Penumbra. And we have two formulations there, Penumbra instant release, but also a Penumbra modified release that are in development. And currently the Penumbra instant release product is being trialed in stroke. But given the expertise that we've developed in melanocortins and the experience gained in going through the regulatory process for afamelanotide, we are now undertaking development of ACTH in various formulations known as Neuractal. The company's made significant progress on this project, and I think in the next slide or one after, I'll cover that in a little more detail. Can I have the next slide, please? Okay, so this is our product portfolio. The top bar, the dark blue bar, shows CNS and where it has regulatory approvals. Then underneath that, there is a series of CNS activities, and then down to Penumbra and Neuractal. If I can have the next slide, please. Thank you. So where are we at with the ACTH program? We've secured manufacturing agreements with a manufacturer for the drug substance itself, and also with a pharmaceutical company to develop the pharmaceutical product, both through the formulation development and also the manufacture of the product. To ensure that we have product quality and consistency, it's necessary to develop a series of analytical methods. And we're at a quite advanced stage with those analytical methods. We're now harmonizing some of those methods between the drug substance and the drug product manufacturer, and we're at the final validation stage for those analytical methods. Our strategy is to have two products, a generic instant release product, which will be the first product that we would release, followed by a branded modified release product, and that's in development at the moment. We currently have a target of 2026 for a regulatory submission for marketing authorization. And then following that, these products will be used for unmet needs, and we have a clinical program planned for West syndrome, which you might also know as infantile spasm, and relapsing remitting multiple sclerosis.